Well, welcome everyone, and I thank you for joining us for what may be our first of what we hope to be many food insecurity measurement conferences. My name is Meg Bruning, and I'm an associate professor in the College of Health Solutions at Arizona State University. I'm also the director of the Transcend program in maternal child health. And I want to thank Drs. Amber Woodich and Alex Brewis, who are the directors of the ASU Center for Global Health, for inviting me to serve as the expert lead for the 2019-2020 theme on complexities in food insecurity and in hosting this event. The Center for Global Health was founded by the School of Human Evolution and Social Change at Arizona State in 2006 to advance our ability to understand and address global health challenges as a critical, complex part of a broader human condition. I also want to thank and extend my deep gratitude to Dr. Brenna Ellison and Dr. Matthew Rabbit for their support in planning this event. You'll get the opportunity to hear more from Dr. Ellison later on this morning. We were planning on holding this event in the spring, but COVID, it happened and is still happening. The silver lining of this is that we're able to hold this event over Zoom and reach more people, as over 130 people registered for the event today. And I'm not sure if any of our speakers are going to talk about food insecurity and COVID, so I just felt the necessity to just touch on it briefly and to acknowledge that we expect rates of food insecurity to increase as a result of COVID, and food insecurity measurement research is even more important than ever. We don't have an official report yet out from USDA on how bad the situation is. And to remind everyone, the national rates prior to COVID had actually been decreasing since the recession in 2008. And last year in 2019, the rates were 10.5% of Americans were reporting food insecurity. So the data that I'm showing right here are data from the Urban Institute showing a positive decrease in food insecurity as a result of the state and national efforts, such as the stimulus checks and PSNAP or Pandemic SNAP. And as some of those initial safety net programs are sunsetting, we're seeing a slow creeping back of food insecurity rates. And Feeding America, the convening hub of the food banks in the US, estimates that we will expect over 13 million increase of people experiencing food insecurity as a result of COVID. And if unemployment rates continue to increase, those projections will obviously also increase. But what if these numbers are underestimates? What if certain populations respond to questions about food insecurity differently? What if our approaches to measuring food insecurity result in different responses? What if we ask about other things? Can we actually be addressing food insecurity as well? That's what we're going to talk about today. If resources remain static, then providing accurate assessments of food insecurity is so critical so that the limited resources that we do have to address food insecurity are helping those most in need. I think it's really important to remind us all of how we assess food insecurity generally in the US. And the USDA Household Food Security Survey Module is the gold standard for measuring food insecurity and was developed by the RASH model, which we'll hear more about from Dr. Wang. The Household Food Security Survey Module is used in the Current Populations Survey, or CPS, which provides our national estimates of food insecurity among US households. And so I wanted to just take some time to remind everyone how CPS tool is administered in household. And this is actually a flowchart that Dr. Ellison created. So there are 4 blocks in CPS, including a pre-screener, and I'm just going to walk through these. So first there's screening questions, and they're listed here before they actually even get into the Food Security Survey module. And this screener block is provided to households with incomes with over 185% of the poverty line. And that's determined based on family income and household size. And if they indicate no food stress on the 2 survey screening module or questions right here, then they're screened out of the rest of the 18 item household food security survey module. All others move to the block 2. So block 2 actually starts the household food security survey module. And the questions that are starred in blocks 2 through 4 are items from the 6-item screener, which many of us use in our research. And so in block 2, if households that answer never true for all of the questions in block 2. They're not moved on to block 3. So here's the third block. And again, if households that answer no for all of the questions in block 3, then they're not answered or asked any of the questions in block 4. Block 4 is the last block. So this is asked of everyone that answered yes to the previous questions, and then this families with households with children then are also asked the 8 additional items for kids. But I pause to wonder how many of us in research actually follow this protocol, particularly the pre-screening questions. Even in this simple difference of administration may be the reason why some of us see higher prevalence data and that are different than the national estimates. So thinking about these measurement issues more deeply is critical in food insecurity research, and that's why we're here today. So I am super excited to launch and to invite our speakers to talk about their work and the advances and innovations that will be shared. I know the work that we're presenting today is just the tip of the iceberg. So we're excited that we're all here together to move this work forward. Before I want to start, I want to extend a special thank you to Dr. Tanaka for joining us. We had a speaker get ill, and so within less than 24 hours notice, she agreed to speak and put together a talk, and it is a fabulous talk. I've seen the slides already. So thank you so much, Dr. Tanaka, for joining us today. As we put together this conference, we tried to highlight different aspects of measurement. So for the students in attendance, these are things that you might want to consider as you're measuring anything, but especially food insecurity. For all of the audience, each talk is estimated to be about 30 minutes, and we're planning a short bio break after the first 3 speakers. And we thought it was important to start with a theoretical framework for the household food security module. So we're thrilled to have Dr. Wang discuss how the RASH model will be used to bring us to the point where we're at. Dr. Ellison will share her qualitative assessments as we will learn how certain populations may not respond the same way to household food security module questions. Dr. Tanaka will talk about how SNAP participation might result in differential responses in the items. And then different measurement and administration approaches will be discussed both by Drs. Norwood and Dr. Brewis. Finally, at the end of the day, we'll share emerging issues. Dr. Calloway from the Gretchen Swanson Center of Nutrition will present some forthcoming work that they are doing right now. We actually had the speaker that got ill was also going to share additional emerging work. And so if you yourself have emerging work, please email me at the email address there, meg.bruning@asu.edu, and I will add you as a panelist, and we would love to hear about what you're doing.